Good afternoon, everybody. Welcome to this new episode of BHHSeries. My name is Aline, and I'm the Chief International Officer of Barcelona Health Hub. So those BHHSeries are monthly online events that we've been organizing from Barcelona Health Hub since March last year, and around topics related to digital health. So we're doing this for and with our members and other experts and guests from around the world. So the new episode today is organized in collaboration with B.Braun, and we will talk about innovation, processes in the hospital with special focus on the operating room, and we will define also value-based healthcare and value-based procurements, so terms that are very fashionable at the moment, very interesting. And we will discuss the importance of those concepts for hospital managers and healthcare professionals to implement value in their processes to provide clinical excellence to the patients. So let me introduce you to my panelists today. So we have Naira Marín, so she's Global Business Services Manager at B.Braun Group. Zepf, Director of Surgical Asset Management Consulting at B.Braun Group. Meritxell Cucala, Director of Innovation and Project at Hospital Sant. And Marc, Director of Strategy and Processes at Essentia. Welcome, everybody. Now I will ask you to introduce yourself more like one minute each. Meritxell, do you want to start?
Thank you. My name is Meritxell Cucala. It's a pleasure to be here. Thank you, B.Braun, for the invitation, and Barcelona Health Hub for the invitation, and to chance to be with you all here. I am a Nurse and Deputy Director of Innovation Projects, member of the Innovation Management Office of the Hospital de la Santa Creu Sant Pau, Hospital de Sant Pau. Our model in innovation department made up of 4 personnels, 1 expert in translation research, 1 expert in health, 1 expert in procurement of innovation, and myself, expert in the hospital management, processes, and project management. For any of you who don't know Hospital de Sant Pau, it's the oldest hospital in the city, Barcelona, in Spain. It's the 2nd oldest in Europe. We attend a population around 500,000 citizens. We have 600 hospital beds, 28 surgery rooms in the main surgery area, 4 hybrid areas, for a total 22 surgery rooms in the hospital, 3 delivery rooms and 26 post-surgical recovery beds. We are 3,500 professionals in the hospital. Thanks.
Fantastic. Thomas, do you want to introduce yourself?
Absolutely. Also, good afternoon from my side. My name is Thomas Zepf. I'm based in our German headquarters in Tuttlingen, responsible for the surgical asset management. What we are doing with surgical asset management is basically doing improvement projects within hospitals focusing on surgical asset management and sterile goods supply, which means we go in, analyze status quo, and follow up with improvement steps in order to just improve patient care and the efficiency of processes. We do that roughly since 20 years on a global scale, which is basically for us the first couple of steps towards value-based healthcare already. So happy to be here and join that discussion.
Fantastic. Welcome, Thomas. Marc, do you want to introduce yourself?
Okay, of course. Well, good afternoon. I introduce myself and my company, Essentia. In this case, Essentia was born from the transformation project of the B.Braun University Hospital in Barcelona. This project now is conducted by doctors and engineers like me with more than 20 years of experience in the management of healthcare organizations. And we help the organizational transformation in health by focusing on people, patients, professionals, providers to be safer, more effective and efficient through processes and technology. And well, in my case, I'm an industrial engineer specialized in the surgical process. I was the Deputy Director of Processes and Innovation at B.Braun Hospital. And now at Essentia, I'm the Director of Operations. Thanks.
Fantastic. Thank you, Marc. Naira?
Thank you very much, Aline. So yes, I'm Naira Marín, and I'm responsible at the Center of Excellence that we have from B.Braun here in Rubi, near Barcelona in Spain, for all the new services and digital solutions that from the company we are working with a very interesting projects, in order to bring value, to hospitals and healthcare professionals. So really looking forward for a great discussion here today. And I would like also to thank you very much for the whole Barcelona Health Hub organization to make this possible, this webinar possible today. And also thank you very much to all the participants to attend here for this nice debate, and looking forward for the great discussion. Thank you very much.
Thank you so much, Naira. Yeah, it's our pleasure to have you here today. I'm sure we're going to have a very, very interesting discussion. So let's go to it. Marc, I would like to start with you. So today we're going to talk about value-based healthcare. And so I would like to ask you, can you tell us what is value-based healthcare to start with, and how is it related to hospital processes efficiency?
Okay, of course. Well, as you know, value-based healthcare is a framework to restructure the healthcare systems with the general objective of providing the maximum value for patients. Value as an outcome of health per unit at costs. The concept will be introduced in 2006 by Michael Porter, but nowadays we have a revolution of these concepts. In summary, value-based healthcare is paying for value, and this means many things. But the first is to focus on the patient throughout the entire care cycle, not only in their passage through the healthcare facility, but also the vision until their definitive recovery. The success of the process should be measured by its health outcomes for the patient, relating it to the total cost of the process. For this reason, it's also important to reduce the operating costs of the process, since all the savings in the process can be reinvested in an improvement in care resources that will have an impact on better indicators of quality in care. In this case, like as you can look here, when we think in value-based healthcare, the first thing we should think about is not about results or cost, but about how we increase the quality of our processes. And we can only work on this if we are clear about, first, the patient safety, second, improving the clinical practice, and at last, the agility and efficiency of the processes. If these processes are worked well, the health resources arrive, and consequently, costs are reduced. And so, first, increase the quality and efficiency of our processes to achieve good results. At last, our goal is best processes, increasing value, the improved results, and the cost reductions. Well, in terms of increasing value in the surgical process, like I like to explain this case, our experience has shown us that there are different phases to focus on, as well as different levels of work. The first challenge is the cultural change necessary to focus on a transformation phase on such magnitude. Here, we show you some of the projects that within their level or phase of the process increase the efficiency of the surgical process and provide us with an increase in real value for the patient and for the service professionals. And in the next slide, as an example, this is an example of, in this case, of B.Braun. We have the project of the surgical process of the new B.Braun hospital block, where after 3 years of improving processes, gaining efficiency, increasing activity significantly, without increasing the single resources, because there's nothing more, we are able to achieve great health and operational results. More or less 8% savings on an annual budget of 115 million euros per year that we reinvest in the improvement of processes related to the patient flow, communication flow, and material flow. That for us is the three flows that we have to study in this case. And well, I hope that I could answer the question.
That was great. Thank you so much, Marc. So, Meritxell, you, from the hospital perspective, can you tell us what is value-based healthcare like in your day-to-day management of the hospital?
Well, not much to add about the value-based care. Great explanation for Marc. No, I believe this is my personal view. That value-based healthcare is to focus on the greatest value for patients and citizens. No? Better health outcomes. Measure health outcomes with the support of technology to solve and meet needs our ecosystem. It means patient-centered care, not just the clinical pathway, but also the patient journal. Thinking in outcomes implies co-creating with patients and other stakeholders to unmet needs, no? For example, to maximize resource and obtain best value for money, no? So I think it's very important, best value for money. And it also means personalized care, appropriate in the most convenient place and according to the well-being of the patient. So it's easy, but I think it's my personal view and point to the value-based healthcare.
Fantastic, perfect. So now I have a question for the team, B.Braun. So it's very interesting to have you here tonight. Very happy to have you. But like we've known B.Braun for many years as one of those big companies supplying products and medical devices to hospitals. But it seems like you've been doing a shift those years towards integrated solutions, which includes both product and services. Naira, can you tell us a bit more about that?
Yes, actually, and this is something which is actually happening today. So this transformation that we all see from the different kind of perspectives, from the hospital perspective, from the experts perspective, but also from the industry perspective, we see that this is happening. This is not the future anymore. This is a reality. And also actually also in this pandemic situation, I think the speed of many things, solutions or innovation has really been really much quicker than expected. So related to your question, it is true. From B.Braun, we have been producing and providing products and solutions for many years. Why this switch from a while ago already? Because we also identify that the healthcare needs also, besides only products or services, something else. And in that sense, we want to provide new services, new solutions that comes from the innovation, that comes from the digitalization, that comes from all the new things happening around us, right? That really provide this value that our colleagues were mentioning, that really contribute to work on this value-based healthcare concept. And we need to do it together. So from B.Braun, we are doing this, let's say, this change, right? We are already investing a lot and providing and working a lot, but also together with all the stakeholders, as Meritxell was saying, in the ecosystems, right? Because we need to do it together in order to bring really this real value that they were mentioning for the patient, but for the hospitals, but for the institutions, and for this, let's say, value concept, all overall.
Exactly. Great. Thomas, do you want to add to that? Like, how is B.Braun concretely helping with value-based healthcare?
Yeah, absolutely. I mean, making a combination of what Marc said and Naira said, interesting is that Marc was talking about the reorganizations with a focus on material flow. And this is obviously where we as B.Braun can come in with our expertise of flow of processes when it comes to sterile goods and or supply. So with our extensive knowledge we gained over the last years, globally, we basically defined and developed a comprehensive portfolio based on consulting solutions, educations, digital tools, and supply management solutions. So here we have basically two concrete examples available. The first one is the one from Naira, so I would suggest to hand over to her quickly.
Thank you, Thomas. Actually, we wanted just to show a couple of examples now. So one of the initiatives from the B.Braun perspective we are already working on, and actually later on we will be also a pleasure not to share with the audience what we are going to start with in Sant together with Meritxell, is a structural consulting service. This is a kind of example on those kind of services initiatives, that besides the product itself, what else we can do as a service to complement this product offering, but to offer this solution concept to hospitals. Some numbers here very interesting in terms of this efficiency that we were seeing, up to 40% of reduction on references, up to 20% of optimization of the catalog, up to 40% on quality upgrade. Some concepts that has been already said in the initial discussion. So how important is to bring, let's say, a quality there. How important also is to try to bring efficiency in our processes, right? Shooters is only an example, but it's for the ones that we really know how is this kind of, let's say, management in hospitals. It's very complex. It's very complex because it affects to all kind of surgeries, to all kind of surgical teams, and it's consumables in the OR. It's really a tough topic and a complex topic. And I like to say that, to be very honest, all of us, we really see that in this area, always there is a room of improvement. And of course, this could be an area that we could together co-create and do things in a better way to bring this value we were saying, right? Thank you, Thomas. I will hand over now to Thomas, also for him to explain from his perspective also what he's working from the company side.
Perfect. Thank you, Naira. And as you explained for the OR consumable supply, basically the same thing is happening with re-sterilizable instruments, assets, equipments. So basically here we have the situation that this was or is still a very underestimated topic, which leads to very inefficient processes and to improvable quality as well. So with our surgical asset management approach, going in, analyzing the inventory together with the hospital in a partnership approach, optimizing the inventory, we are able to, on average, reduce 23% of inventory from the surgical sets. So this means basically almost a quarter of volume that is basically put the process each and every day unnecessarily. Due to these inefficiencies, we also have, of course, quality issues. So even here with a sufficient and proactive supply management, we're able to improve the quality of the equipment by, on average, 40% as well. So these are just, I would say, kind of two very specific examples from Naira and myself, where we really can bring value in the topic of OR and sterile goods management supply in the hospital, in the operating room directly.
Yeah, actually, if I can just jump in, if you can put the first slide on those three, the first one, and just to connect it to the one that was actually sharing now, Marc at the beginning. We saw there that the quality and the efficiency and the cost saving, right? So I like it also what he was mentioning, because it's also aligned with what we are trying to do from the services and from this value-based also healthcare concept from the industry side. So we can also bring it from our side and to working together with the institutions, with the experts on bringing this value into the market, to bringing this value into the hospitals for both things in the OR, which is the topic of today, even on consumables, even on surgical assets. So this ordering, digitalization, protocols, processes efficiency, equipment conditions. So there are so many things that could be done, and this is our aim, and we are passionate actually to work on this transformation, bringing value really, no? So thank you very much. Yeah.
Thank you. So, Naira, you were mentioning before a project that you are currently doing with Hospital Sant Pau in the gynecology area. So I think it would be great to see if you could talk more about that project together with Meritxell, so we can really understand from a concrete case how it works.
Yeah, sure. Actually, I will. Sorry, Meritxell. I will hand over to Meritxell.
Sorry.
So actually, we have a video.
Actually,
the video.
Yes, much better. Okay.
B.Braun was the first company to industrialize the suture sterilization worldwide. We have more than 100 years of experience in sutures and more than 30 years in consultancy with Escalop instruments for the different surgical specialties. The complexity we have in suture management could be an area of improvement, and we want to help you to do it together. Imagine that you could have a standardized, digitalized, up-to-date and easy-to-access suture catalogue. Would you be interested? We present you the B.Braun Suture Consulting Service, a modular consulting program for the hospital focused on clinical excellence and sustainable optimization of the suture catalogue by specialty and surgical procedure.
Naira, do you want to tell us more about the project?
Well, yeah, of course, it's a kind of initiative, as I was telling before, that really wants to help hospitals and teams, to identify where we could bring this efficiency, and where, first of all, identify areas of improvement, and then also to bring new proposals in terms of becoming more efficient on the processes, but also in the complete solution in terms of optimization, efficiency, and also working from a very clinical perspective. So working on this procedural approach, so we see from all the perspectives, also from the hospital side, from our side, that we need somehow to gain efficiency, but also related to what we are doing. So today in the OR, you have a surgical activity plan. You have so many surgeries to run during that week. And it is important to know what is exactly the usage of what you are needed for those surgeries, and have really the efficiency in all the processes in order to also to have transparency and also a very accessible data, and related to what is happening in the hospital, and also related to the patient. At the end of the day, we were saying on the colleagues that the value-based healthcare, it's focused on the patient and real value to the patient. So this is also one of the aims of this kind of initiatives. But I will hand over to Meritxell, and she can explain much better. Yeah.
No more. Well, not much to add about the project after Naira's and Thomas's great explanation. Well, for example, when you enter in the surgical resident in your first surgical room, you learn to do surgical sutures the way it's done by the expert surgeon, and you understand that is the way it's done everywhere, It's very hard to keep up to date with new materials, needles, technologies, and you might find out years later than the trends shifted a long time ago. Shifted from traditional procurement practices of material and medical devices and to service B.Braun sutures, for example, consulting project that allow us to keep up to the date with the different options and uses, and wider set of possibilities. For us as a hospital, this along continuous learning and training of our professionals of the available alternative and adapting of their sets of skills and knowledge. It's important for these continuous alternatives and adaptive.
Fantastic. And maybe Meritxell, if you can tell us a bit more, like why you find that project interesting, when B.Braun maybe approached you to do that project, why do you think it was exciting for the hospital?
For the hospital, for us. No, for this explanation, I think it's the important to introduce the difference kind to introduce the technology and the knowledge to the professional.
Okay, fantastic. Okay, so now I would like to move on, and so we talked about value-based healthcare, and I too will also talk about value-based procurement. So Marc, maybe back at you. Can you tell us a bit more about value-based procurement?
Okay, of course. Well, value-based procurement. Well, value is defined as the patient's results relative to the cost of obtaining those results. And in this case, value-based procurement is about making purchasing decisions that consider how a product or solution can better deliver the results being measured and reduce the total cost of care, rather than focusing exclusively on buying a specific product at the lowest price. That is, it's obvious. In this concept, it's about changing the customer-supplier relationship that currently exists between industry and hospitals to tend towards a partnership collaboration to supply the correct product for each patient at the correct time and at the best price, which results focused on the patient recovery. This is the key of this concept. Yeah. At last, healthcare procurement professionals tend to work in isolation from the clinical environment, physically removed from what the hospital is doing. Over time, the focus on cost reduction has been taken to such an extreme that clinical benefits and long-term value is often deprioritized for the sake of short-term savings. Yeah, and in this case, in my point of view, in the same concept of material flow, for us, this new concept of value-based procurement is very important for the efficiency and for this new kind of relationship between industry and hospitals. The providers like partners, not only buying a product at the lowest price. Yeah.
Okay, fantastic. And Marc, so imagine that today there's a lot of hospitals who are listening to us, and maybe they're in a situation where then they would like to improve their processes, but they're not too sure about it, they doubt about it. What would you tell them to convince them to take a plunge and to do a project like B.Braun and Hospital Sant did?
Yeah. Well, it's not usually, but that the time has come. Now it's time to review our processes and improve them internally. We have great opportunities within our surgical blocks, which will benefit patients, but professionals too, and the hospital itself, of course. In this case, with B.Braun, the suture is a part of a logistics process. This material flow. The suture in general, it's a high volume, but a low-cost product that has never been given the importance it has. Choosing the best suture and the best technique implies better or worse results in the patient's recovery. And good stock management can represent great savings for the hospitals. For this reason, I say yes, it's time to review our processes, of course.
Naira, do you want to add something from B.Braun point of view? What would you say to hospitals who are listening to us today?
Well, actually, yeah, I was just taking some notes, because not from a personal perspective and from a personal point of view, I was very, very curious to ask to Marc and Meritxell, from as experts in their positions. We are talking about how important is the value-based concept, even on the healthcare, on the care providing this excellent care, but also from the efficiency point of view, and also from this sustainable point of view. When do you see, or in your opinion, when do you see that this new, let's say, procurement or value-based procurement, or these new formulas in the system will allow really the implementation of these new solutions or these new initiatives? So because we know and we see that there is already existing channels to do that, but it's still a small part of the reality what is happening today. My question to you will be: when do you see this as a common situation in our reality? So as a standard situation. In 2 years, in 3 years, in 5 years, in 10 years?
or now, no? I think that now it's the moment. Well, Meritxell, if you want.
Now it's changing, right?
Marc, you are consultant? I don't know.
No. Well, it's true that today it's a necessity. Yeah, hospital must now the results of its actions on the patient returns home, and it's obvious that we need to reinvest our point of view inside our surgical blocks in our wards. Yeah. At last, hospitals have the activity monitoring tools, but they usually focus only on registration data. No? And it's necessary to provide new tools for monitoring and accompanying the patient throughout the entire process. Yeah. And well, for this reason, applications such as the proposed by B.Braun, like for patient APP, or other ones. These platforms provide this new approach to communication and support between patient and hospital. No? For me, this is the new approach, and this is we are not talking about future. We are talking about now. Now it's a necessity, and now it's the moment. Now in this context. Yeah.
Well,
But
I
Marc,
think.
Sorry, Meritxell, go.
No, I think the problem is that the hospitals mainly measures what buyers demand, no? In healthcare, we have a big challenge to understand the cost on our service, no? Or accounting methods center of the credit costs somehow in the process, no? But we are from having analytic accounting linked to outcomes, no? So I don't know, the public insurers and the healthcare providers need to align on this to meet the needs of value-based management strategy. No? Okay, now we measure things like infection and surgical areas, number of repeat surgical procedures, I don't know, no? Surgical times, environmental and waste management, no? All of this allow for managing process, quality standards, and minimizing errors. Like pathways, but I think but that's not enough. No, we have difficult to measuring outcomes. No, I think it's necessary. It's change the cultural. No.
Mm-hmm. And do you think this is happening, Meritxell? So it is happening also from the inside hospital perspective. For example, in a way that maybe a new people from hospitals are professionals working to measure these KPIs that you're mentioning, right? So to measure this kind of outcomes and then to implement in a way to also to request this better clinical outcomes, no, with the solutions that maybe are out there. And then so this change that we are seeing in the ecosystem, that we are also experimenting by ourselves in the industry side, this change is also happening in inside hospitals?
I think yes, in the field and number of professionals, not now changing the thinking, the knowledge. I think the new generation, no, they more I don't know, more important to them the outcomes, no, the outcomes are your Sorry, my English.
The patient
process,
outcomes, no? Clinical outcomes.
Yes. Sorry.
Yeah.
But I think this is a really good example why we need to have that collaborative approach in the value-based approach, because obviously healthcare providers are focused on patient treatment and therefore on patient flow and measuring things around that since ever basically. But things like process flow of material, of supply. Obviously, this is a core competence that the industry has to a certain extent. And here we, by joining our first forces and by joining our expertise, this is where we really can make a difference in these secondary processes as well, and improve the efficiency of the treatment and of the hospital as well.
Mm-hmm.
So maybe if we can talk a bit about those value-based healthcare models, how do they fit in the hospital, and how can the hospital measure that value-based healthcare? Who wants to start? Thomas, you want to start on that?
Yeah, of course. I mean, again, coming from my profession, from a sterile goods management perspective, here, of course, our main objective is to deliver the equipment in the right time, in the right place, in the right condition, in the very end. And here there are some in many hospitals some some measures that are existing. There are some still missing, but really taking a deep analysis from, let's say, the OR back into the supply, into the sterile processing department, and analyze deeply where the improvement potential lies, brings us a transparency that we can then start to improve. And here are basically systems already existing. We have usually a tracking or documentation system that can be utilized much smarter as we do right now, but of course also the OR system as well. The combination of that data brings us a value that we kind of just scratch the surface actually. And this will be one basis that we need to utilize to do the improvements as well.
Meritxell,
I
can
think
you
that,
tell us?
Naira.
No, I was just thinking out loud that, of course, that we can, and we are already working in how we can also bring solutions and value on those on this efficiency in the OR, which is the focus of today. There are so much processes, even with the assets management, but also with the consumables as we talk it. But I think I wanted to highlight that in the end, what you were asking actually, and also pointed out, Aline, in terms of how do we measure that in terms of this value at the end of the day, So value-based healthcare, the focus is the patient. So I think that maybe we can also, there is something that for all of us to take more in importance and to take more into consideration about the patient satisfaction, the patient quality of life, because it is not only what is happening in the hospital, right? So what is happening after the hospital stay, after the surgery, and therefore the patient experience at the end of the day is not only that the surgery has been perfectly well during the time that he was in the hospital, but also how the wound is recovering, how is the full recovery for him or for her. And therefore, the consequences and the impact of what we are doing, providing efficiency, even in our consumables, assets, or the whole process, it has an impact at the end of the day, also in this patient experience, and also in this patient satisfaction and quality of life, and also in parallel could be also a consequence on reducing complications like incidents of the wound, of the surgical wound, or even reducing complications like going back to hospital for any urgency need or whatever. So this kind of improvements in the whole flow, it affects also during all the patient journey, that some of you also were mentioning this concept. I think that this is also important to highlight, that it is not important also to measure the processes inside the hospital, but of course with the outcomes and with the patient in mind, right? Meritxell, you wanted to...
No, I think it's another point is integration with levels of care, no? Higher levels, it's important to be direction relationship with citizens and patients, no? Interoperability among health systems and the hospital process, patient, professionals, I think.
Of course.
Marc, do you want to add something? You muted, Marc.
I'm not muted. No? You can hear me?
Yeah, no.
Okay, yeah. Sorry. Well, now, it's true that we are not used to measuring value. Hospitals usually end their care when the patient walks out the door, but the recovery continues at home and in primary. And sometimes the recovery is complicated. It's true that there are initiatives such ICHOM, with PREMS or PROMs, still highly concentrated in clinical pathways, very allocated, but with great potential to be replicated in all diagnoses. But it's true that we need the technology that can afford this new point of view. We have a lot of work to do to arrive to a whole concept of value-based healthcare with all the clinical pathways, not only the more fashion like a stroke or some kind of oncological diagnostics. No.
Mm-hmm.
Maybe now I'd like to talk a bit about the economic side of it, because now we're saying that with value-based healthcare, we're trying to reduce admission, so less patient coming to the hospital. But isn't that a bit contradictory for the hospital? Like if there's less patient, there's less income. So how is that positive for the hospital? Meritxell, Marc?
Well, I start. Well, sorry. At the end, reducing the stay is very beneficial for the patient, of course. While it seems that the hospital is also going to need to have contracted personnel, yeah. But this has an impact on a greater potential of capacity for the new patients admissions, and this is higher the incomes in this case. It's true that readmissions are always negative, especially for the patient, of course, but for the hospital, it can be a great financial burden. In the future, we are convinced that the health system will pay by value, with which not only will the hospital be paid for the activity we have done, but also for how we have solved the problem for the patient. Yeah, and for the reason we have to reduce the length of stay and, of course, the readmissions.
Mm-hmm. Meritxell?
I think the systematic reducing length of stay and or reducing readmission, no? For example, systematic improvement of the process, increase the standard of care provided, no? I think it means that our resources are maximizing our limited human and the structure, no? Structure resources, for example, no? This might allow more activity to be programmed and reduced waiting lists. This means we're doing more activity with the given resources.
Mm-hmm.
Perfect. Team B.Braun, do you want to add something to that?
Well, I think that my personal view is that also I agree with what Marc and Meritxell was saying, no? That maybe at the first point could be challenging how we are going to to do it. No, if we have less readmissions, but at the end of the day, allowing also the major goal of the to be and to go to a more sustainable healthcare system. No, so in this sense, what Marc was saying also, that providers are going to be paid by the value, no, that you are offering, and by the clinical outcomes that you are achieving. So it is also our duty, our responsibility from all sides, right, from the industry, but also from hospital side, to provide real value to the system, and to the processes, to the patients, to the healthcare system in overall. And therefore be compensated, right? If you are doing the things right, you are compensated. No, so I think that that's the point at the end of the day, and this is all our contribution to make a sustainable healthcare system, and to really focus and push forward this value-based healthcare concept, no, that we all see.
Perfect. Yeah. And so we talked a lot about hospitals, no, the benefits for the hospital as an institution. What about the benefits for the healthcare professionals? So being like surgeons, nurses, etc. Where do you see the concrete benefits of that value-based procurement?
I think a value-based hospital will imply more capacity to generate mesurables, KPI, no, outcomes in health, no. Hospitals have with professionals with higher safety standards, continuous trainer, learning and knowledge generation, no, with the capability of fast introduction of new evidence based on practice and innovation, no. It also means more multidisciplinary teamwork, integration, no, I think.
Perfect. Thomas, maybe?
Yeah, absolutely. And I think increasing value also has something to do with increasing stability, and therefore, increasing the comfort level of all the healthcare professionals. I mean, they have obviously a very hard and a very high responsible job. So what we want to, what they want to have is a kind of safety and security in that. And that's where I see value-based healthcare is supporting as well, to keep staff happy, motivated, and feel confident in doing their daily work, rather than firefighting from time to time.
Perfect. And maybe another actor that is always at the center of everything that we do today is the patient, right? So now we mentioned the patient a bit along that conversation, but what are really the benefits for the patient of those value-based procurement happening in the hospital? Marc, maybe do you want to start?
Yeah, of course. Well, at final, the benefit is obvious to everyone, no, patients and professionals. And it's true that in the end, in the future, all of us will be a patient, no? And of course, we want that the care system runs well, no? It's true that in this sector, we have the particularity that we don't work with products, we work with people, with persons. It's important to work better for them and for us, no? And for the reason, this new concept of value, it's value for all, no? And not only it's an economic question for the hospital. It's crucial for the sustainability of the system. Yeah, we know that we don't have infinite money to sustain this activity, and we have to be more efficient with all of points of the system, not only assistential and safety. Of course, we have to pay for the best process in the maximum of efficiency. Yeah.
Naira, maybe from your point of view, like benefits for the patients, or to add to what Marc.
totally agree with what it has said. I think that here also another important point is that it's patient and families, no? So I would widen a little bit the concept to the family, because patient as individuals, of course, is very relevant, and there is a high value there. We need to do the things valuable enough with the right impact, and because all of us, we will be patients. But I think that another concept, important one to highlight, is the families, and we have experienced actually this important concept of the families in the coronavirus situation that we all have lived in the last year, and we are still in this pandemic situation. So if we bring value to everything that we do in the healthcare system, in the processes, in the let's say in the outcomes overall, in the end also we are helping those families, to recover and to become and to be more satisfied and in terms of receiving this care excellence from the system, no? So just to highlight the concept of patient, but also the families, so important.
Fantastic. Okay. Well, I think that we've come to nearly to the end of the session today, and as a conclusion, I would like to ask each of you to summarize like that session today. When we talk about value-based healthcare, value-based procurement, value for the hospital healthcare professionals. Just one word, if you have to summarize that session today, which word would you pick and why? Naira, do you want to start?
Okay, wow. Okay, it was coming to my mind. I think that it's a teamwork. All players that we are here today. So to make it possible, we need to do it together. Teamwork,
Fantastic.
I would say.
I like it a lot. Marc, what's your word?
Well, I have to say a sentence. Best processes, increased value. This is a conclusion.
Perfect. Meritxell?
I think value. The value.
Perfect. Thomas, last word?
Last is always hard, but I would say measuring, because we can only improve the value sustainable if we measure the outcomes and the steps in between.
Very good.
Fantastic. Well, I would like to thank everybody really for that great panel, those great insights. I think it was a very, very interesting conversation. It's very exciting to see what's happening, what the future of healthcare, like the present, really looks like. And for all of us patients, as we said, and that can really help us at the end. B.Braun, thank you so much for supporting that event today. And so we see you again. The next BHH series will be about recruitment. So we will talk about recruitment challenges, about onboarding, about people development and culture in like pharma companies, medtech companies, startup environments. So you can find more information on our website, barcelonahealthhub.com. So thank you for joining us today. See you soon. Have a nice evening. Thanks everybody for being here.
Thank you very much. Bye-bye.
Bye.